It is Thursday evening. As you guys come into the room, do me a favor and just say hello. Let me know where you're watching from. I just wanted to go live really quickly instead of doing a video that I got to edit and all of that. I said, let me just go live really quickly. But I wanted to remind you guys about the importance of medication reconciliation. Okay. Now, what is medication reconciliation? Medication reconciliation is when you are confirming patient medications. Okay. That is when you are making sure that what you have on a patient's chart, what you have on a patient's file is what the patient is actually taking. Okay. It is very important that you ask your patients, hey, are you taking any medications? Once the patient says, yes, I'm taking medications, what medications are you taking? If the patient cannot verbally, tell you every single medication that they're taking, it is okay to say, well, we have here on your chart that you're taking lisinopril. And they say, oh, yeah, that's for my blood pressure. I'm taking lisinopril. Okay, how many milligrams is it? How often do you take it? Do you take it daily or whatever, right? You have to reconcile medications at each visit. I'm going to tell you guys, first of all, you guys know as medical professionals, it's very important for accurate documentation anyway, right? But I want to tell you guys just a quick story about when I served as an expert witness in a medical malpractice case. Now, I cannot get into details about the case. However, I can tell you that the patient ended up passing away, okay? The patient passed away because the doctor ended up prescribing a medication that interacted with the medicine that the patient was on. Okay. Now this is why it's so important to reconcile medications, because if that provider knew that patient was on a medication that interacted with the new prescription that the doctor sent in for the patient, he would have never sent that medication in. Okay. Patient literally died like 2 days later. All right. It is so important, guys. I know it can be time consuming. Sometimes your patients may come in with a full list, right? Especially if you working in specialties like I work in cardiology. Patients sometimes come in with a big old bag of medications. It is better to take the time and go through each one to make sure you have it. One thing you can do too, so you won't take as much time at the visit, when you're doing your chart preparation, your pre-chart and all of that, I don't know what you guys do at your practice, but maybe see if it's okay to call the patient in advance to verify their medications, especially if you notice you're doing your pre-chart and getting ready for the next day. You may want to call your patients and you may can reconcile the medications then. But it's very important, again, if that provider knew, yes, Vita, I see your sad face and I see some of your comments, guys. I'm gonna address them in a minute, but I wanted to tell you guys that before I started answering questions or anything, I wanted to just remind you guys the importance of going through each medication, because like I said, that provider would have never prescribed that medication if he knew that patient was on that other medication. Okay. Another thing too, full vital signs on your patients. What are full vital signs? Blood pressure, pulse, right? Heart rate, respirations, temperature, height, weight. Now, depending on what specialty you work in, you may not have to take a full set of vitals. However, if you notice a patient is in distress, let's just say you work at let's just say a dermatology office, right? Dermatology, you may only need height and, well, not even height. Dermatology, you may only need maybe a blood pressure, if that, maybe weight, depends. And I'm just using dermatology as an example. You may work in dermatology and you may take all the vitals, but I'm just saying a lot of specialties, you don't need to take all of the vitals. However, even if you're working in a specialty that does not require all the vitals, if you notice a patient is in distress, the thing about that situation that I'm telling you guys about, that patient was clearly in distress visibly, and it was noted in the patient chart, and that the person that brought them back did not check respirations. They did not check a pulse ox, and that person was clearly in respiratory distress. Okay. This is why I'm telling you guys. Also, history. It is very important to get accurate information on your patient. Okay. Now, I've always known this as a medical professional, but once I served as an expert witness, seeing it from the other side, I really learned how important it is for documentation. It is a legal document. If that provider is ever taken to court, right, you are covered because you did everything you're supposed to do. So if you were the medical assistant that brought that patient back, If you went over every single medication, right? You obtain an accurate patient history, their medical history, surgical history, all of that. You've taken full vital signs, okay? You have covered yourself because you've done everything you were supposed to do. So I just wanted to remind you guys that. And please listen, do not falsify respirations. I'm going to say that again. And the reason why I say that is because I know people who would literally just put, oh, 14, 16, 12, just make up respirations. I have worked with people like that. If you did not check respirations, do not write it down. If you did not check heart rate, don't make up, don't, guys, we hold people's lives in our hands, okay? Even something as simple as height and weight. If you didn't check that patient's height and weight, don't make a note of it. I don't care what the patient got at home. The patient's weight at home is going to be less anyway because they were probably naked, right? So if you did not check that vital sign, if you did not take that measurement, don't document it, okay? Now, if you happen to document something that the patient took at home for the provider, all you have to do is just make a note, patient reported, this is what they got at home, or patient reported, this is the weight they got at home, okay? Do not falsify. I don't care what people tell you, because guess what? What if the patient's respirations were abnormal and you wrote 16, which is good, but then that patient actually had a respiration of, I don't know, let's just say 30, you know? But you would clearly see that if the person has a high respiration rate, you will be able to see that. But again, the situation that I'm telling you guys about, it was noted that that patient was visibly in distress. A history wasn't taken. Medication reconciliation wasn't done. Okay. Full vitals weren't done. Okay. So I just wanted to remind you guys of that. Documentation as well. Any conversation that you have with the patient, anything that happens with the patient, it needs to be documented. What do they say? If it's not documented, it's what? It's not done. If it's not documented, it did not happen. Okay. So it's very important that you cover yourself. So just listen, learn from the mistake of others. Like I said, I was an expert witness in that case, and it really came down to not getting an accurate history, medication lists, and full vitals, because they would have, if there were so many things that went wrong with that visit, that they could have realized some things weren't right. But anyway, let me see what you guys are saying. So let me know if you guys have any questions or comments about that. I'm not going to stay on here long, but I wanted to share that. I wanted to do a video, but I don't have enough space on my phone, and then I don't feel like editing and all of that stuff. So I said, let me just go live. You're welcome, Vita. Watching from North Carolina in urgent care. Vita, let me know how you like in urgent care. And Vita, if you're still watching, let me know in the comments, and for anybody else that may be watching, how do you feel about a new MA working in urgent care? And anybody that's watching that works in urgent care can answer that, but I mentioned Avita because I see that she said that she's in urgent care. But let me know. I get that question a lot. I've never worked in urgent care, so I can only talk about what I know about it, from just research and just from other people working in it that I know. But let me know, guys, down below, that for those of you who work in urgent care, let me know what you think about a new MA working in urgent care. And good luck on your test. I see you said you're taking it on June 1st. Make sure you come back and let me know when you pass. Congratulations, Taryn. She said I passed with a 411. Congratulations. Monet, congratulations. Everybody that has passed, congratulations. Vita says, can you tell me how to take better respirations? So yeah. So guys, with respirations, you guys know respiration is a full inhalation and exhalation. So one thing you're looking for is simply for the chest to rise and fall. So what I usually tell people, because sometimes like when I'm teaching my students, they're like, Miss K, I can't see the chest. I can't see his or her chest rising or falling. I say look for something on them, right? So like for an example, my top, right? When I'm breathing, I'm sorry, y'all. That's the breathing, sorry. When I'm breathing, you can see my scrub top. So I say look for something. If you cannot actually see the person's chest rising and falling for whatever reason, just kind of look for their top to be moving a little bit. Even if if the person's hair is sitting on their chest, look for that, okay? Another thing you can do is, with the patient's permission, you can ask if you can, you can kind of hold your hand there to feel for their respirations, okay? But it's just a matter of watching that chest rise and fall, okay? Because every Every inhalation and exhalation is a breath, okay? And that's what you're counting. Some people make the mistakes of counting inhalation as 1, exhalation as 2, but it's no. That's a breath there. That's 1 respiration, okay? And never make it up. I don't care if someone that was training, because like I said, I know people that have done that. I was trained at a place years ago, and I remember they said, 16. They was like, just put 16. That's what it was last time. No. If you didn't check respirations or any other vital sign, please don't make a note of it. And I know this, some of you probably listening to this like, why would people do that? Trust me, I'm mentioning it because it happens, okay? I'm mentioning it because it happens. So I just wanted to remind you guys about that. Hey, Michelle. Vita says, I'm a certified phlebotomist, but I was hired as an MA. Oh, gotcha. Okay, so that's cool. I mean, I hear the other way around, usually hired as, you're an MA and doing phlebotomy, but I didn't know this. I don't think I've ever, I don't know. Have I known some, I don't know. I don't know if I've ever seen somebody actually a phlebotomist and they got, well, I can't even act surprised, especially if it's a private office. It's no telling what'll be going on there. All right, guys, let me know if you have any other questions. I don't want to be on here too long because I wanted to get straight to the point. I'm just getting off. I'm actually sitting in my car. I'm about to walk in my house. I just wanted to do this live video really quickly while it was on my mind because we were talking about it today at my job. And I shared that with others about how important it is to document. It is better to over document than to under document, okay? It's better to have too much than not enough. So any conversation you had, make a note of it. If you instructed a patient to go to the call, let's say a patient is having an emergency, right? Because this has happened. We had a patient calling in with chest pain, shortness of breath. We instructed the patient to call 911 or get someone to take them to the hospital, and they took it upon themselves to drive, and they end up having a heart attack. Okay, but because we had documented in the patient's chart, we were covered because we instructed the patient to call 911. In some cases, you may have to you may have to keep that patient on the phone and call for them, right? But I just shared it to say that it's very important to document. It's a legal document. If your provider ever has to go to court, you're covered. Okay. And remember, as medical assistants, you are only covered as you are working within your scope. If you are advising, diagnosing, and treating a patient, you are working outside of your scope and you are not covered by that provider's insurance. You are covered as long as you're within your scope. How long do you count? 30 seconds. So I don't recommend doing 30 seconds until you get comfortable with a minute, honestly. So when you guys are doing heart rate and respirations, you always want to do a full minute until you get comfortable doing 30 seconds. Also, if you're ever doing a patient's heart rate and respirations for 30 seconds and you notice it's abnormal or the rhythm isn't, it's off rhythm, particularly the heart rate, you do it for 4 minutes. So even if you are advanced and you can do heart rate in 30 seconds, if you notice you're checking that patient's heart rate and you notice a skip beat or extra beats, you want to check it for a full minute, okay? Always check for a full minute when it's abnormal and when you're just starting out. Something else I was going to say, do not do the 15 seconds and multiply by 4. I know that's a thing that they say because you could do 30 seconds and times it by 2. That's okay, but that 14 seconds divided by 4, 15 seconds, I've never subscribed to that, and I do not recommend that. I don't teach my students that way. When they ask me, can they do that because they've heard that others that do it, I don't recommend that. We want accurate vital signs. And so if you're not going to do the full minute, do it 30 seconds. If it's abnormal, if you notice the heart rate is abnormal, then you want to do it for a full minute, okay? If you ever get an abnormal vital sign, you want to repeat it. For blood pressure, if you guys are checking blood pressure on a automated machine, if you get, and first of all, if you get 140/90 and above, you want to check it again, especially if this person does not have high blood pressure. Some people you get come in, they already have a history of hypertension. That's kind of, 140/90 may even be good for them. But if you get somebody that has a abnormally high blood pressure, meaning they don't normally have high blood pressure, wait another minute or two, check it again. Okay. And then if it's still high, you want to double check it. You want to check it again. In this case, this will be the third time, but this time you're going to do it manually. So if it's too high or too low, always check manually. Okay. Always have your stethoscope with you, even if you have a automated blood pressure cuff. Okay, always have it with you because you never know. Some providers prefer manual anyway, but then some, they'll take the machine. But if it's too high or too low, you need to double check it. You make sure you guys watch my blood pressure video on the channel if you struggle with blood pressure. Just look up Miss K blood pressure. Vita says that's how I was taught to times. Yeah, 30 seconds to times about 2 is fine. I was saying the 15 seconds and divided by 4. I do not recommend that. I don't do that. And I don't teach my students that way. 30 seconds by 2, 30 seconds and then multiply what you get by 2, once you get comfortable doing it for a full minute, right? And then you're going to do it for a full minute regardless if you're doing it for 30 seconds and you notice that heart rate is abnormal. Because what happens is if the person has an arrhythmia, meaning that their heart is off rhythm, right? Maybe they have extra beats, or maybe they have skip beats, right? They have pauses or whatever. If you only do it for 30 seconds, you're not going to get an accurate heart rate. You're going to have to count it for a full minute. Heart rate is how many times a person's heart beats per minute, okay? If it's off rhythm, you got to do it for a full minute because you're not going to get an accurate reading. Okay, guys. All right. Let me know if you guys have any questions. Don't forget, guys, if you are started studying for certification, I have my MA refresher course. It is listed in the description box. It's marefreshercourse.com. If you're taking one of the administrative tests like CMAS or CMAA, all you have to do is do the administrative refresher course. If you are taking the RMA, if you're taking the CCMA, if you're taking the CMAAAMA, you need the clinical one because the clinical refresher course has both clinical and administrative. Okay. Don't forget, guys, I have my necklaces. That's listed in the description as well. Make sure when you check out, you add in the notes section on the shopping cart page the name that you want on your necklace. It takes like 14 to 21 days. It takes a while for it to be made and sent out. So if you guys do that, just like I said, don't forget, put it in the shopping cart page, the notes section of the shopping cart page. All right, guys, I don't see any questions. You guys have a good day. There's a video that's going to be posted on Monday. I don't know when you guys are watching this. If you're watching it live, you're going to see a video posted. I did it the other day, and it's scheduled to post on Monday. And it's my study tip. If you follow me on TikTok, you probably already saw it. But it is going to post on Monday. So you guys have a great day. I love you guys. Let me know in the comments if you're watching a replay. Let me know if you guys have recently passed certification, especially if you passed from taking my MA refresher course. I really want to hear from you guys because I need those reviews. So let me know. I'm also looking for people to give me video reviews too. So if you passed from my refresher course, give me a video review, okay? And you can send it to my email that's also in the description box. Congratulations, Chaco Kisses. Is that Shy Coco? I think that's what it is, but congratulations. All right, you guys, take care.